Next, you go to your onco. Follow up with your onco, please, okay? Because you need to get treated. So whatever treatment it may be, whether it's surgery, chemo, radiation therapy, immunotherapy, targeted therapy, or natural therapy, okay? So you have to get treated and don't just focus on one treatment and forego all the others because all these treatments complement each other. Okay? The main goal of these treatments, the combination of these treatments, is to give you the best outcome possible.
Hi everybody, welcome to another episode of Simply Healed. Today's episode is going to be so helpful for patients who've been just diagnosed with cancer. We're going to answer that all-important question, but before that, let me welcome Dr. Jansen. Dr. Jansen, welcome back to another episode of Simply Healed.
Hello Sean, hello everyone, happy to be here again.
So tonight we're going to talk about actions to do after diagnosis. So you've been diagnosed with CA. That is a very serious diagnosis. You are probably stressed, feeling very strong emotions, and your family is probably also feeling very strong emotions. At this time, panic should not be the thing that you do. What we always want to share with you on Simply Healed is that there is hope, all right? And if your diagnosis was in the early stages, stage 1 and 2, for many cases of cancer, you are going to get well. So if it's stage 1, for most cases of common cancer, the recovery rate is in the 90 percentiles, which means you are going to get well. So if it's the 3rd and 4th stage, then this tonight's show is very important. You have to know exactly what to do immediately, even before your next appointment with your doctor. So doc, what do we do when we are diagnosed with cancer?
Yeah. So it's very understandable that it can be so overwhelming. You don't know what to do, and or there's so much to do that you don't know where to start.
Yes, and sometimes the worst part is your doctor may not have spoken to you a lot.
Yeah, a lot.
They just tell you, I'm going to treat you, don't worry, you have prostate cancer stage 1. And then that's all he says. And he told you not to worry. But you're worried because that's all he said.
Yeah, exactly. So sometimes it can be, why is my doctor only told me this? Something's wrong. But I mean...
So tonight, we have an AMA, Ask Me Anything segment after this. So we are here to answer all your questions that you forgot to ask when your doctor gave you your diagnosis. It could have been just yesterday or some time ago. So tonight, just take the opportunity, stay with us until the end of this segment, and we will move to the live Q&A, and you'll be able to ask all the questions so that you're clear on what to do.
Okay, so what I did was to create a checklist for you. So this is how you should go about, this is how you, in general, this is how you should approach after you get diagnosed with cancer. No? So number 1 is to change your lifestyle immediately.
I like this, doc, because changing your lifestyle is not dependent on the pharmacy or the doctor or the hospital. It's literally the moment you know you have cancer, this is what you can do for yourself, right? I see here the normal advice of diet, exercise, and positive psychology. I want to say this diet thing, doc, because sometimes, we meet many patients, and many patients actually, I just met with my neighbor a few weeks ago, and she was diagnosed with breast cancer, and she was going for chemotherapy. And her doctor, her oncologist actually told her, well, as long as you're going for the chemotherapy, you can eat anything. And immediately, she knew in her heart that was not right, because her mother had breast cancer and her mother watched her diet and changed her diet. So, doc, I just exchanged Viber messaging with her. So I just want to share with you some good news before you even continue. Her doctor said she could eat anything, right? And I talked to her and said, no, you can't. Why? You got breast cancer because you had the wrong lifestyle. So the lifestyle caused the cancer. Now that you do have cancer, that same lifestyle is going to make the cancer worse. So you got to meet Dr. Jansen. So I arranged for her to meet up with you. And this is this is what she told me. She's now able to sleep. She had to take sleeping pills while she was on chemotherapy because she couldn't sleep. So I can imagine you have cancer and you can't sleep. how tiring. It's like tiring upon tiring, right?
Yes.
And then she was not always feeling weak. And then she was confessing to me, now she's eating healthier. And she was also on some protocols like PIPA protocol, and she can sleep.
Wow.
Okay, so that to her is amazing. So she said it made the protocols, the advice, the change in lifestyle, the PIPA protocols made significant impact on her chemotherapy. So there you go. This is something that you can do immediately for yourself, independent of your next hospital appointment or appointment with your doctor. Yeah, Doc, maybe you elaborate a little bit more.
Yes. So now, of course, you just got diagnosed with cancer. So immediately, you do whatever you think is healthy to do. Okay. So that's changing your lifestyle. You be proactive. Okay. You don't wait for your doctor to advise. Now, of course, we have to optimize. So this is the time that you follow up with your doctors, your lifestyle medicine doctor, yours truly, and then your on-go. Okay, very important that you follow up with those two. Okay, so number one, on my part, my role is to optimize the food that you're eating so that you will be more guided, it would be more structured. So you know where to source them, you know how to prepare them, and for the more nitty-gritty part, just to guide you on whether or not this product is okay or this product is not okay. Right?
Doc, you're being too modest. Honestly, Doc says that he's there to monitor, to optimize your nutrition. But if you really understand what Doc Jansen is really doing for you, what your lifestyle medicine doctor is doing for you, is that he is taking care of the rest of your body. So remember, normally people won't have 7 specialists because the medical bills will scare you as much as the cancer. So I understand. So normally you have an oncologist, and you would ideally want at least a lifestyle medicine doctor or a doctor like Dr. Jansen. Why? Because the oncologist, your onco, is a specialist focusing only on the cancer. He's focusing only on the cancer. But when you fight cancer, you gotta make sure your kidney is functioning, your liver is taken care of, so that all the waste material, toxic material that comes from fighting cancer and from, example, chemotherapy, the toxic substances that your body reacts from radiation therapy, all these needs to be displaced by your liver, your kidneys. Your lungs have to stay healthy. Your heart has to stay healthy. Your bone marrow has to stay healthy and not be damaged by the chemotherapy. All these things are important, and no one's looking at it because your onco is really not looking at it. He's very highly trained and is a specialist in treating the cancer. He's not thinking about how to take care of your kidneys, and if that is an issue, he will probably recommend a nephrologist to be part of the team. But like many people who go for cancer treatment, having a team of doctors sometimes is pretty scary. Yeah, it could be confusing as well and sometimes intimidating. So at the very least, have a doctor that supports all the rest of your body, and let the onco focus on the cancer. So that's a very important, very, very important approach to fighting cancer. Yes.
Okay. Now, next, you go to your on-go. Follow up with your on-go, please, okay? Because you need to get treated. So whatever treatment it may be, whether it's surgery, chemo, radiation therapy, immunotherapy, targeted therapy, or natural therapy, okay? So you have to get treated, and don't just focus on one treatment and forgo all the others, because all these treatments complement each other, okay? The main goal of these treatments, the combination of these treatments, is to give you the best outcome possible. Okay? So it's very important to undergo the treatments that are recommended by your onco. And then, what your part is to watch out for the side effects. If you feel the side effects, follow up with your doctors. Okay?
How important is managing side effects?
It's very important because sometimes it is the one that determines whether or not you complete the protocol or not. And completion of the protocol sometimes, not sometimes, always determines whether your survival rate is high or low, or whether or not the cancer recurs.
And this is important. So number one, side effects are important to monitor. If you can't eat, you don't have energy. If you don't have energy, cancer is actually a disease, an illness of starvation, because your cancer cells are stealing nutrients from your healthy body. So if you're not eating, that's not good, right? So these side effects are critical. Just having a low appetite is not something to ignore when you have cancer.
Yes.
I remember one of our programs, you said cancer patient, you said first thing, eat a lot. I mean, that's a very mundane advice, but it's very critical and important for cancer. But some other more serious side effects could be like your red blood cell count is dropping, your white blood cell count is dropping.
Yeah, because of the chemo and the RT.
And if it gets low enough, you can't continue with your treatment.
The onco will stop the treatment because your body cannot handle it. So you would have to wait further for your body to recuperate enough for you to continue the treatment.
And if you wait too long, the cancer might mutate.
Sometimes you're back onto square one. So
yes.
That's
so you don't want to lose momentum when you are fighting cancer. So it's so important to take care of, have a specialist like Dr. Jansen taking care of the side effects of the cancer treatment that you're going through. Down here, you are a lifestyle medicine doctor. So in your protocols, you don't prescribe drugs.
I don't.
So it's kind of, I'm sure some of the viewers are thinking, you don't prescribe drugs, but all you are talking about is chemotherapy, radiation therapy. So why not just natural?
Because sometimes natural treatment, although yes, there are some few cases that natural therapy works, but however, these are the minority. Okay, the majority of patients is that doing natural treatment alone won't work. Okay,
and I want
to combine everything.
Correct. And I want to say to everyone, if you asked me 5 years ago, I'll be pro-natural. I'll be very, very pro-natural because I have this idea that the treatments, chemotherapy, radiation therapy, do as much harm to me as the cancer itself, right? But today, knowing Dr. Jansen and new developments in our protocols, the PPR liquid extracts, we are able to manage a majority or the major parts of the side effects of chemotherapy and radiation therapy. So then I look at this radiation and chemotherapy with a different light, because I have also seen many people go natural and then they die. They die from cancer, right? Then there are people who went for chemotherapy, the cancer died, but they died from the side effects of chemotherapy. But here it is, you see, if you go natural, you die from cancer. If you go for chemotherapy, you die from the side effects of chemotherapy. But here, what if I can manage the side effects of chemotherapy? Then the cancer dies and you are alive because we can deal with the side effects of chemotherapy. But if you go for natural, if it doesn't work, then you die from the cancer. So when I look at it this way, suddenly my whole view towards treating cancer is also different. And I've also realized, Doc, this last few years with climate change, that affected our food supply. So the quality of the vegetables, everything that you eat, the quality of the air. Now we have crazy temperatures. When it's supposed to be cold, it's hot. So I look at it and I say the natural world is not ideal, especially if you live in a city, having to have work in order to pay for your expensive organic vegetables that you're eating for cancer and medical treatment. And we have many patients have children to look after. So we don't live in an ideal, in a farm world out there with super clean air. Pollution is really bad all over the world, even the air that we breathe. So suddenly I realized, there is a lot of common sense that we don't live in an environment where just going natural will work.
Correct.
Correct.
Then one of the good news is as well is you'd be worried of side effects of chemo. No, majority of my patients are actually worried. I don't want to go for chemotherapy, doc, because of the side effects.
But now they're all happy because their tumor is gone and the side effects were not as bad as they thought.
Not as bad because I always give simulator papers to manage the side effects. So it's one of my strategies that now you know how. Okay.
Now you know how.
So okay, now you got treated. Now that you are on remission, what do you do next? The fight doesn't stop there, okay? You're still not out of the woods. All right? So Now we go to post-treatment care. So for post-treatment care, you continue with your lifestyle change because more often than not, the food that you eat is the one that triggers your cancer coming back. Okay? So that's very important. You have to be consistent. Number 2, continue with the natural treatment. And lastly, we just monitor. Take a look at the imaging, take a look at tumor markers. Okay? So that's how we approach
treating
treating
cancer.
cancer.
This is a checklist. This is what you do after you've been diagnosed cancer. You know, Doc, just yesterday I had a conversation with a patient all the way in the United States, and the patient was very, very happy because this is a wealthy patient, so he had many doctors, but he found that me, not a doctor, a research expert in PPAS, actually gave him a clearer picture of how to fight cancer, because I went to him and showed him the whole approach to fighting cancer, which is number 1, get yourself strong, and straight away from day 1, the moment you are diagnosed with cancer, we are already preparing you for after the surgery, after the chemotherapy, what to do next. The whole process we don't just stop at the chemotherapy. We look at the whole process all the way to the 5-year mark. So we are thinking, I explained to him, it is so important to take care of your body while you're going for chemotherapy, because if you do that, then your immune system is intact after the surgery and after the chemotherapy, and your chances of getting second bout of cancer is reduced. So even from day 1, we are already reducing your chance of your cancer coming back. Because Doc, when you did that special on cancer recurrence rate, my jaw dropped. Viewers, did you know for ovarian cancer, 85% on average, 85% of people who have ovarian cancer, the cancer will come back. So how can you go in treating ovarian cancer without straight away thinking already about the minimizing the recurrence? And this is why I hope today's program gives you a complete picture. And I can see right now, questions are pouring in. Maybe what I said is triggering some questions in your mind. So Doc, anything else, or should we move to the AMA?
Yeah, I think we should move to the AMA already. I see a lot of questions coming in as well.
So let's move to our Ask Me Anything segment.